All right. Hello, everyone. Welcome to the 600 Pound Down podcast. I'm one of your hosts, Coach Justin. Aside with me, my friend here, my fellow coach member, Coach George. George, how you doing tonight?
Oh, I'm doing fantastic. Just got done with a 10-hour shift, and now we're hopping on here. So I was home for about all of 45 minutes before getting on with you guys. And you know what? Can't think of a better way to end my night, honestly.
I love it. And he took his hat off a little bit ago.
Yeah, we're not going to do that.
You guys don't want to see that.
No,
You probably should. It'd be amazing.
No,
Pressure's on.
we're not going to do that. Yeah, we're not going to do that. A lot of what was the comment earlier? I'm still in my work clothes. So for those of you who don't know, I do tabletop butchering work. So I'm still in my work clothes. Thankfully, you only seen the top half. We won't worry about what's going on in my pants right now.
That would have made it a beautiful reel though if you would have took your hat off. I would have had so much fun with that. It's not even funny.
What did it? I look like Beaker from the Muppets.
I love it. Oh, so good. Yeah, we're excited to be here tonight. This is actually one of our first lives in a very long time. We have a very special guest tonight. Tiffany Ryder is with us tonight.
Yes.
And man, I was on her podcast at one point, the Healthcare Liberty Lab podcast. Phenomenal stuff. She's going to talk more about that later tonight. But we definitely want to tackle her story. She has a pretty remarkable story, and her passion for health and wellness. It really is something that's exceptional. And I love how she really encourages people taking ownership of their own health. I mean, that is so important for today's culture. I'm really about that because we have so many influencers out there that are saying, do this, do that. We have doctors telling us to do this, do that. But when it comes down to it all, man, we need to take ownership of who we are, know our body, know the signs, know the signals, and know how to prevent things, take care of things, and all the things. Partner with our doctors even. So we're going to hear a lot about that tonight. And of course, she has a lot of other things to share tonight. But George, what are you thinking about this, man? I know she's here like waiting to talk, but what are you thinking? Are you excited for this?
Well, Tiffany, some of the things I'm really excited to hear about is that a lot of the times I think we get shut down by our doctors quite often. For a lack of knowledge, lack of paper, we don't have a MD on the end of our name. And really what it is, it's the argument based on authority. And so one of the things that I would love to talk about tonight with you is how do we as a patient overcome the stigma of, well, my doctor isn't really going to listen to me, or he doesn't really know what I'm talking about. But we do know our bodies. We know what's going on with our bodies. We know how we feel. We know what helps. We know what hurts. And that is a conversation I'm really excited to have with you, because I think if we can have some practical tools going into the doctor's office, I think that would really be helpful for just our longevity and our peace of mind at the same time.
That's my favorite thing to talk about. So
beautiful.
So I think we're good.
Yeah,
Awesome.
That was a really good. George, you said it perfectly there. That really is her story. That's really what she loves to talk about. So, Tiffany.
It really is. I don't shut up about it. So.
Come on in. So tell us a little bit about yourself. Who are you? What do you do?
Yeah, so I've certainly had a nonlinear career. I started my career in a performance art. I was a dancer for 10 years and then went into medicine, and we can get into like how all of that happened. But like I knew that medicine was what I was meant to do, and I really grew up in not an affluent part of the country, and was in an area where we were all poor, and no one really knew much. No one knew a doctor, right? Much less like had access to one or health insurance or any of this. And so I really grew up in this community where people felt helpless. And so, I decided for various reasons early on that this was the direction I was going to go to, and ended up in the emergency room because, again, those are my people. We don't have health insurance. Like, you get sick, you don't know what to do. You go to the ER. And I'm not suggesting that. It's a horrible idea. But, this is where we find ourselves. And so I went there, right? And then I was the expert. I was going to save everyone. And sort of the experiences that I had when I was there revealed to me pretty quickly that it's not about, being a better physician or clinician or, working harder, doing more. There are systemic things in place that just make it really difficult for everyone to succeed, for the doctor to do the right thing, for your nurse to give you the care that you need, for you as a patient to ask the right questions. So it's just sort of this maze. And I found that really everything that I did was basically like telling the patients like, hey, this is how you talk to the secretary when you call your doctor's office. And, this is how you do things. So that's sort of how I got into this world of having a podcast, being on podcasts, doing more media stuff, really going back to that first 10 years of my career of media and marketing, was because I really recognize that it's not the medicine. We have lots of really smart people doing really awesome things in medicine. And it's not that patients don't necessarily want to take care of themselves or they don't want to advocate for themselves. It's just like this fundamental communication problem. And so now I have built a couple of businesses basically solving for those communication problems, whether it's helping companies teach regular people how to utilize the healthcare system better so that, maybe they spend less money on their healthcare spend or, things like that, or are willing to utilize a non-status quo, non-standard healthcare option like direct primary care or something like that. And then the other side of it is I work with businesses and professionals to sort of teach them like, hey, stop talking all of your nonsense. And like, here's how you can communicate with real people about real problems because you have awesome solutions, but here's how we translate. Yeah. And so anyway, that like I'm in these different spaces, but it makes sense because really I just want to be able to bring people together so that they can communicate effectively.
Yeah, that's really, so you have that's a beautiful intro, by the way, of what you do.
Yay. Okay.
So I just want to say good job on
it's
that.
Always the awkward thing, like where someone's like, hey, can you just talk about yourself for 5 minutes?
Oh my gosh, yes. Seriously.
Yeah.
We get on here on a podcast and everyone's like, oh, you really like talking about yourself? No,
I don't.
That's
why
we interview people.
That's right.
Yep, it's true.
Really
but then
don't.
Also, you can't be effective if people don't know who the heck you are, what you do, or why you're doing it.
Right.
Exactly.
Takes some getting used to, definitely, to do that. But I love, so your heart shines in your intro there, okay? I mean, it's about being an advocate for people to better themselves, better their health, figure things out, to really understand the basics and the advanced information that's out there when it comes to health, wellness, medical attention, everything else that goes along with it. But every passion is birthed out of a story. And I believe that 100%, an experience, right? So what's your health story? I love to hear your health story a little bit more, I guess, in a little more in-depth conversation. Where did that take you in life? I know we don't really, you're more of a different team fan than I am, and we have a little bit of,
I am.
We have a little bit of a tension there.
In the middle of the screen.
Yeah.
She was like,
I'm a Philadelphia Eagles fan.
That's why Georgia's right.
Yeah.
Eagles fan.
I'm an Eagles fan, and she's more towards the Commanders, man. And that just, I almost didn't have her on because of that. But because of her heart, I had to bring it up. It's just fun. But I'd love to hear where things have gone for you and where you've been. I know you've been rejected by things due to your health, and I'd love to hear more. So can you paint a picture for us?
Yeah, I don't mind sharing at all. For me, it's, I think I sort of came to this idea that like doctors don't know everything and that medicine is nuanced. Sort of organically, I wasn't looking for any answers, but coming from the background that I came from, like I said, I didn't really have a lot of interaction with the healthcare system. I saw people not really get adequate help, but not really have a filter or a perspective to even understand what that meant or how you were supposed to do it. And I actually got married at 17, married someone who was in the military, and started college and got pregnant at 18. And
this is wild, Tiffany. This is wild. It's a cool story. I just want to say
now that I look back at it, right? But at the time, this all just made perfect sense to me. So I move across the country. I'm like 19 years old. I've got a brand new baby, and I started having like adult sort of health problems. I ended up 25 pounds overweight. Was having, some issues with my menstrual cycle and whatever. Went to the doctor and they said, oh yeah, you just have like PCOS and, maybe you have this thing called prediabetes, which honestly, I'm surprised that they even diagnosed me with that, 25 years ago, 24 years ago. But, they said, yeah, you have prediabetes. And I said, oh, well, I don't know what any of this means. Like, I don't know anything about anything. What, like, do I have to take medicine for that? What's the deal? And they were like, no. It's like not that big of a deal right now, but sort of the course is that, as time goes on, your cells will get less and less good at processing sugar and insulin. And then, you'll get to a point where it eventually turns into type 2 diabetes. You have type 2 diabetes in your family, right? Yes. Okay. Well, that's just how it goes. And, when we get to that point, then, we usually put people on this drug called metformin. And then, when that works for a time, and when that stops working, we do other things. And I said, whoa, like, this is so sad. Like, I'm going to have type 2 diabetes. Like, isn't that bad for people, And it went along my merry way because I was 19 and decided, whatever.
So this was 19 years old.
Yes.
And they're saying this stuff.
Yeah.
Okay.
Maybe I was 20 at this
okay,
point.
but you're young.
Very early on, yeah. And I just thought to myself, well, this is a bad luck of the draw, but lots of people have this happening, especially coming from the community that I came from in Louisiana, where we just love everything fried. We love good food. And I said, well, I guess this is what's going to happen to me. Okay. And it never even occurred to me that that there was really anything to do about it, that there was any other way. And so anyway, I continue on, I'm going to college, I'm raising my daughter. And at some point I start to get the sense that I might be able to do big things in life. Like, what could those big things be? I don't know. I'm little, but let me look for something. And I'd always loved dance. And I said, well, what if I could be a professional dancer? I'm going to be an NFL cheerleader, which is ridiculous when I look back at it again, right? This seemed completely normal, but I was like, oh, that's crazy. Or I didn't say, oh, that's crazy. Anyway. And so I tried out for, you're going to love this, Justin. I tried out for the Eagles. And for the Ravens and for the Redskins that year. And I didn't make it past the first cut for anything. And I was completely clueless, oh, I wonder what happened. So I had a boss, actually. I was teaching a group exercise class at a Gold's Gym, and I had a boss, and she pulls me over, and she was very, very respectful and very sweet. And she said, sweetie, you are beautiful, but I think maybe if you want to be a cheerleader, you probably need to lose 20 or 30 pounds. And I was like, whoa, okay, wow. Really? Okay. But it was the nicest possible way. We had a relationship. I said, okay, well, how do I even do that? Right. I was already active. I was already whatever. And so she basically, she was probably 45, 50 years old. She had lost a lot of weight through diet and exercise. And she said, well, I can help you. And she taught me, that eating brown and serve rolls at night for dinner, a whole tray, wasn't really the appropriate meal for weight loss.
Shout out to this lady knowing her stuff.
I mean, whatever. And, she was like, it's so, it's really sweet that you love to do cardio. And, I'm sure that's good for you. But also, there's some weights over here. Here's how we use them, right? Yeah. And so she really just took me through, held my hand with kindness and love. And I lost I don't know, 25 pounds. And I tried out the next year. I made it. All the things were great.
How long did that take? Let me interrupt you real quick, because this is a good story. And I'm putting a bookmark in that. How long did it take you to lose that 25 pounds?
It was pretty quick. I was incredibly motivated. It was within 4 months.
Wow.
Shoot.
Wow.
It was within, I was right. And she explained to me, look, it's 1 to 2 pounds a week. Here's how you do it. And I was I was having the time of my life. I was meeting new people, and, it became my entire social network and identity. And I don't know, it was fantastic. It was a positive experience for me. I started getting all of those non-scale wins. Yep. Is that what they're called?
Non-scale victories. Yep.
Yes. Yeah. Non-scale victories. Where I was oh, wow. I can just pick up my kid and it's not even that hard, or I can walk for longer. I can study longer. I was in college, and yeah, it was a really positive experience for me. So I thought nothing of this health thing, still thought that I was like on my way to type 2 diabetes, like, but whatever, at least I was going to be able to cheer like before I got there, or, maybe during. And then, it wasn't until probably a year after I made the team, ended up back at the doctor. And I was like, oh, I actually don't have all of those problems like with my cycle that I used to have. And I actually like, oh, look, my blood sugar looks great. My A1C is great. Like I didn't
gosh, I'm
even
healthier.
know it was related until later. And so
So
anyway, so that was my introduction.
were you like doing this whole thing and just still thinking, you lost 25 pounds, you're lifting weights, are you just still thinking, well, this diabetes is inevitable?
Yes. I had
That's
no
insane,
idea.
dude.
I mean, because I didn't know. I didn't know anything about medicine. I didn't
We
take
take so many
know.
things for granted here on this show, Jay. Like
Yep.
we just think, oh yeah, if I get healthier, then therefore the bad stuff will kind of dissipate a little. That's a reality check for me.
What's interesting though is nobody explained that to her.
No, I know.
Think about that.
That's crazy.
She found out later by experience, but
Yep.
this wasn't preached to her as much as probably it should have been. At least equipped. You should have been educated a little bit by
100%.
and we're probably gonna talk about this too, Tiffany.
Yeah.
We should have took some ownership of that as well, right?
Yeah.
It's a two-way street.
I mean, all of it, right?
Yeah.
Like, and I mean, yes. Okay. Yes, I should have taken ownership for it, right? But also, right? Like, how do people even know until they know?
Bingo.
Right.
Yeah.
And I do love, that's one of the reasons I was, when you asked me if I would come on this podcast and do this interview, I said, well, heck yeah, I will. Right. Because anything, like, what if there's a 19-year-old sitting somewhere who's heard the same story? Like, I do not believe that we are over that, even that initial hump. Like, I don't think that everybody knows that these health problems and are related to something that we can have some control and some autonomy to change. I just don't think that's common knowledge for everyone yet.
Yeah. No, I agree with that. I think there's, I'm really a fan. I haven't heard much about RFK doing, I know it's probably a lot of stuff that we don't hear about right now, but there's nothing in the media, of course, mainstream media right now, that has really made the news on what's going on. But do you know anything? I mean, are you aware of anything new that he's working on offhand?
I mean,
Besides
there's
his
so
eyes.
many things. My inbox is full of press releases from HHS and FDA on a daily basis.
I know you would have me in, so that's why I'm asking.
I mean, I do. So, one of the companies that I've founded in the last year is, one of the things that we're doing is creating content that is, again, geared at the end user, geared at the patient, at the end consumer. But health policy is something that I think most people walking around at the mall or, at the park, like, aren't really thinking of, right? I'm not thinking like, oh, RFK Jr. might make a decision today that it's going to make my life better. And I'm going to understand what the heck he's talking about, right? And so one of the things that we do is we do our best to actually translate some of these higher level things in a normal language so that you don't have to care about health policy so much to understand how it's going to affect you. And I have been extremely pleased to see, maybe we aren't where we're going to be 3 years from now, right? Like, all of the changes have not been enacted yet, but it's been a slow progression that continues to increase. And at the root of all of the things that they are talking about at HHS and FDA is, okay, we're making these assumptions. Are we happy with these assumptions? Is there research to back these assumptions? Have we looked into this? How can we better educate people? How can we better get to this root cause? And that's now a buzzword that is, sometimes controversial. Like, I don't understand how, but it is. But there's a lot of focus on, I get it. Type 2 diabetes is a problem. Oh, I get it. Kidney, like dialysis for people's kidneys is an issue. It's very expensive. It's horrific. But what if we could think about what people are eating when they're 6 years old in the school lunch program, and that could change all of these other things. And so I've been really pleased to see the administration really focused in on how far back can we move the intervention, or can we move the research, the body of research that's being done, or whatever it is, to intervene as close to the source as possible. And that, I think that's been a positive thing in this administration.
That's really good. That's good information to hear too. I mean, because again, we don't see the curtain pulled back often unless you're really seeking it out.
I mean, you really have to seek it out, because the mainstream media doesn't cover the good news. I think just in general, not even about one administration or another. It's just like not really top of mind. And so you do have to look for it.
Yeah, that's good. That's good. So, George, you have a question? You want me to lead in? You got it.
Well, I was gonna say, I wanted to ask you. So you cheerleading, you lost it. You got on the squad, and what made you start doing all of this? Like, what was that? What was that gear shift? For you?
So my dad was in Vietnam and had raised me that the military deserves the utmost respect and deserves all of the gratitude and anything that we can do to support them. And so one of the highlights, I think, of being on the cheerleading team was the ability to directly interface with organizations like the USO. And so, you have like paid appearances that you can do, but then there are also these unpaid opportunities that you can do. And the paid ones generally, go faster. And then, you have these other ones. And I was like, I don't really care. Like I lived north of Baltimore. So like going to an appearance was always like a chore anyway. So I'm like, I'm not going to do that for a couple $100. It's probably not that motivating, but the opportunity to do it to support a cause that I really cared about was interesting and motivating. So I signed up first in line for all the USO things. And one game, I don't remember what game it was. I don't know how it happened, but one game, like a couple of us were asked to go visit the governor's suite. The governor of Maryland had a suite and could have guests there. And so there were 40 or 50 people there. And so we go in, we're in uniform, we walk in this suite, and the governor's there, his family's there. But also there were a bunch of wounded warriors. He had invited the Wounded Warrior Project, had hosted some recent veterans returning from Iraq and Afghanistan. And I went there and I sat with them. We could spend as much time as we wanted, like visited with them, heard their stories, met the people that were running this program. Well, the people that were running the Wounded Warrior Project and that had arranged for the transportation and all of that for these amputees to come to the suite were based out of Walter Reed Army Medical Center. And I was an exercise science major because at that point I had decided like, wow, okay, exercise can do really cool things. Like, I don't know what that means, but like, I kind of like am moving in this direction. I loved science. I was good at it. And so I said, look, I don't know, like if you have like any jobs or internships or like anything, but like my heart is in this and I love this. And I would just love to learn more about what it looks like to work in a hospital and support people who really need help. And like, maybe I want to go to medical school or something, like, I don't know. And so I exchanged contact with them. The woman basically talked to the colonel who was in charge of that and like created an internship for me. And I went and I worked at the hospital for a couple of semesters with these troops. And, I had no like real marketable skills, right? I'm like a junior in college, like maybe a senior in college. But I was interested and they took me on these trips and, we biked from Gettysburg down to the Capitol in DC, like using the assisted, bikes that worked with these troops' new bodies. I saw people with traumatic brain injuries who were severely depressed and, had complex PTSD and had, all of this stuff. But the hospital, which, looking back at it, I now think had a lot to do with the high visibility of the program and the PR. But the hospital, really took these men and women, and neurology was, integrated with occupational therapy, that was integrated with physical therapy, that was integrated with surgery. They came in with their families and they were broken. And when they left, like they were whole, right? And it was such an incredible transformation, and it was something that I was just so proud to be a part of. And I said, wow, like I saw people go to the hospital and just get sent home and, commit suicide and like have these horrible things happen when I was in childhood. And then I came to this place and it was like, oh, the hospital is actually like a real place where like amazing things happen. And so for me, I wanted to be a part of that. And I knew that I was young, my body was young, I was, doing a physical athletic job, and I knew that I could only do that for so long. And so I said, okay, I'll do this thing. But when I'm done doing this thing, I know where I'm going. And so that's really what made the transition for me.
Wow. So your passion grew at that point, just to want to take care of people and help people. I think, do you think that's the heart of all the frontline clinicians and the people go into the medical industry, be it doctors, nurses, PAs? Do you think everyone shares a desire to really help people? And if they do, what do you think changes over time when sometimes patients are just patients and not people? They're no longer people.
Yeah.
They're just
What
another
is?
number. Can you speak on that? I mean, because you've seen you have firsthand experience of
Yeah.
what
We're
you've
getting
seen.
to
And
that.
I can't wait to hear. I want to obviously all names and everything else we're not going to
Yeah.
mention. Maybe
We're
not even
getting
the
into it
actual
now.
story, but maybe just some summarizing. But whatever you feel comfortable with, we're never gonna ask you to share
Yeah.
something. But what are kind of going to the question I've just given you? Um, what did you experience? Have you seen frontline medical professionals kind of act that way, and what changed for them, and what do you think goes on there?
I mean, so I can only share from my own experience, right, of it. And my bias coming into this conversation and in life for anyone who knows me is that I am just an eternal optimist and I see the best in people, and that's just who I am. So, do I think that everyone who goes into medicine goes in with good intentions? No, just because I'm a realist, and I don't think that that's possible. But I like to think that most of us do. I think that I know that there are very easy ways to make money and support yourself. There are plenty of stable jobs in this world. And even for a physician, right? I have a friend who's a neurosurgeon out in California who makes, I don't know, the Twitter put out his salary, and he makes, I don't know, $600,000-700,000 a year, right? So you could say, oh, look at this guy. Look at this guy. He's in it for the money. But then when you break that down, right, and you take like the individual who is intelligent enough, whose family, has the means necessary to have supported him and helped him. I mean, I don't know if they did, but I assume that most people who go into medicine and go into these long surgical tracks have some support system. That individual who did that for 15 years or whatever it is after school, like they could have done a lot of things to make money, right? So, you didn't need to go to college for 4 years, an excellent college, and then to medical school for 4 years, and then, to a 7-year residency where you made, I have no idea, but, first, second year residents make like, $50,000, $60,000 a year, like of which they spend, 90% on like Chick-fil-A while they neglect their own health, because like what the heck are you supposed to do
Yep.
when you're on call and working insane hours? So like when I look at like what's required to actually get a license to make money, it's just not worth it. Like it's just not worth it. So what's left for me is that, yeah, I think that most people who go into medicine are doing it for the right reasons. I think, and I mean, this is my experience of it. I've seen people that are jerks who have treated patients. I've seen people who don't really tend to have, a ton of empathy. I think it's rare, even in the people that maybe to the patient, it seems, aren't empathetic. They come back to the desk and they say, man, I really wish I could help this person. I don't know what to do. So I think that a lot of it is just the system is stacked against you. You want to do the right thing, but it's challenging with all of the things that you have to manage, with the hospital administrator saying that you have to follow this, standard of practice, this protocol that maybe you don't agree with, having to make 22 clicks to be able to order a medication for the patient sitting in that bed right there that like shouldn't have to be that hard. I think that all of those things matter, but for me, this was the number one reason that I wanted to transition from full-time clinical work to a more business-oriented non-clinical work. It wasn't about, oh, I can't do that anymore, or, oh, I'm so traumatized by the things that I've seen, even though like I wasn't living a healthy life or a happy life for much of it. It was really that in order to see people that are hurting so deeply and know them and care about them and feel like there's a power dynamic where you're up here and it's your job to pull that person up, and you literally can't, because you just can't, because the system is stacked against you and there aren't enough hours in the day or dollars on, that are available to you. And like to be able to do that and go to work every day and come home and not just be suicidally depressed, I think you have to sort of get some calluses, right? Like you have to figure out a way to not be so open and raw and vulnerable. And maybe that, I don't know, like I said, I only know myself. And I started to feel like I can't remain this emotionally vulnerable and connected to my patients and available and live and practice in this way. And so either I have to change so that I can function, or I got to get out of here. And like that was my choice. And so when I look at it, even a doctor or a PA or a nurse or whatever who's just seems like a horrible, mean person on the outside, like I have so much empathy, right? Because I don't think that any of us really like went in with that, but I think years of abuse from all sides, and then years of I went into this to help and I'm doing everything I can, and I'm unable to do what I want to do, I think can make anyone calloused on the outside.
Yeah.
Justin, that was a very like insightful and intelligent question. So now I'm going to pivot to my question.
Is it less insightful?
So this is more like societal and cultural curiosity on my part, because Justin asks all the very good questions, and then here comes George with like, all right, I want to see what she thinks about this. For your normal person, kind of experiencing ever since COVID, and I promise I have a point. Ever since COVID, medical dramas have really been on the rise. And some of those medical dramas, I think, are depicting the system as caring more about money than they do about people. And I want to ask your opinion. We talked about the individual doctors and clinicians and everyone else kind of going into this, really do wanting to help people, but having to form those calluses because this is very overwhelming. Now I want to talk about the system. Who is the system practically benefiting right now?
United Healthcare. Is that an answer?
There we go. That's basically what I thought you were going to say. But elaborate on that, because I think a lot I would love to hear from you.
That's a really good question.
Yeah, I mean that was a joke, kind of, right? Like I don't know.
If we can't laugh, we have to cry. That's
really true. It's really true. Like I don't know who's the big name we can pick on. I mean, I think they're on the list. So I think that it's more complicated than it looks on the outside. And if I were to break it down for someone who, again, is not interested in health policy, is like, look, I'm just trying to like care for my family. Who can I be mad at in this situation, right? Like, who's to blame? There isn't a singular answer. And here's why. Justin knows I just can't stop talking about direct primary care. Direct primary care means I go to a doctor. That doctor says, hey, instead of like billing your insurance and playing this whole game and like me paying 30% of my profits to a billing company to like fight with the insurance and then like just do a bunch of nonsense, and so let's just skip all of that. Do you have $100? And I say, yes. And I say, okay, you give me $100 a month and I'll just see you whenever you need care. Okay. And I'm like, yeah, that sounds great. Right. Okay. So that is an example of sort of a free market, right? Like I have money, you have something I need. And I say, well, that costs less than my cell phone bill. So, okay, let's do that. And then we do that and it's fine. So I think that I don't want to say that, you know, private equity and the hospitals and all of this stuff, and, you know, it's this profit driven mess that's causing the situation that we are all experiencing, because I don't really think it's that simple. I think when you look at the 18-month wait list to see a specialist for, I don't know, a knee problem in Canada, that's just as bad, right? They have no access either, right? Or NHS in England. So I think it's more complicated, but I think what we have happening is we have a system where regulations that, again, I am forever the optimist. I would like to believe that regulations are being put into place because we're trying to protect people from the big bad influences that are out there. But what I think we've accidentally, hopefully accidentally, not purposefully created is a regulatory environment where the only people who really can afford to be compliant with the law and with the regulations, you have to be big enough to be able to afford a team that tells you how to do the things, and then to afford all of the, you know, and then there are other laws, like if a new hospital wants to open in your neighborhood, they have to go through this legal process where they ask all the other hospitals in the area if it might be okay for them to open a new hospital. And if I'm making money, like, my answer is no, it's not okay for you to open something that might be better than what I have. So I think that we have this interplay between the organizations that are large enough to understand how this complex system works and understand how to manipulate with their, you know, money that they are using to lobby, with our money, honestly, that they're using to lobby our elected officials.
She's going there. She's going there.
I mean, I had to, but to structure things in their best interest. And so, you know, like, we recently had this whole hoorah about like Medicaid, and, you know, we were looking into Medicaid. Regardless of what you think about Medicaid, it's a safety net program, right? Like that is what the intention was. When whoever voted to say, yes, we need that, they didn't, like, they voted so that we'd have a safety net for people. So they weren't in the emergency department. So they had access to primary care, right? It's a very, I think, makes common sense sort of argument. But then when you take that and you say, okay, well, we don't want to do all that paperwork. It's a lot of nonsense because there's all this regulation. But I guess United Healthcare, or like someone else, right? Like the insurance company, let's like have one of these big companies sort of like do all the administrative stuff and like take care of the program, do all the paperwork. And of course they have to get paid for that, right? So you end up having like these large companies that are administering these government programs. And then, like, if I could do it for 100 people, that's great. But if I could do it for 100 million people, that would be better for my bottom line, right? And so then you make the argument that, like, maybe this is the way it should be, encompassing more people and doing more things. And so then I think we end up with a situation where there's more waste than there needs to be. Now we have, more people who maybe aren't the people most in need, who now qualify for these other programs. And then maybe now it's harder for them to get care because there's more competition. So it's like, we have all of these misaligned incentives. So you ask the question, who's benefiting? And I think a lot of people are benefiting, and it's a lot of people's faults. And, I hate to play the oh, it's the middlemen, but I think it's the middlemen, right? Like, I think that the more people we get in between the patient and the person who can help them, the more confusing it gets, the harder it is for people to navigate, the harder it is for the people who are actually performing the service to make money, the more expensive it gets along the way. And I just think it's quite a mess at this point.
So you say that, it sounds messy. So
It
sounds
messy.
like
Feels messy in
it's like
all areas.
it's like when a cat plays with like a yarn ball. You don't know where it starts, you don't know where it ends, but you just know it's a ball, and
Yes.
you know there's a bunch of strings involved. Yeah. So that's their plan, and for lack of a better phrase, their plan is not good. So what would be your I'm a linguist tonight, Jay.
Theologian. That's what you are.
Really pulling it out.
So my question to you now is a follow-up question, I guess.
Yeah.
How would you want to rectify that? But what would be, if you could have full reign your plan, what would you do?
Oh, I love it. So I don't have a plan. I don't have a plan. Okay. And here's why.
Let's go.
Here's why. Because the system is so complicated that I feel like I don't have a good grasp. I can't tell you my health policy plan. I hope RFK Jr. has done his homework and has a good one for us. But I can tell you what I tell every single person, really. It's not even my patients anymore. It's not my clients. It's not like the people that I counsel for them. It's literally every human that I care about. It's like, look, the play is you should do whatever means necessary to need medical care as little as possible. And I think that's the play, right? And I think that should have always been the play. Unfortunately, kids are born with sickle cell every single day. Kids are born with hemophilia every single day. People get, different diseases throughout their lifetime. And I don't know what to say about those things, right? And I think that is what our healthcare system should be there for, is to manage these things, to manage the accidents, the injuries, but getting yourself into a position where you understand how to interact with the medical system, I think is important, which is like something that I know we're going to get into. And then also like just being as healthy as you can be, whatever that means to you. And no, that doesn't necessarily mean like doing whatever some influencer told you to do, right? But like, I like to say, I know, George, I know. But like, I'm talking like common sense stuff that your grandma told you to do.
That's right.
Right? Like going back to just basic principles and saying, honestly, what makes sense? And have I tried this and does it work for me?
Yeah.
Absolutely.
Man.
So yeah, go ahead, Jay.
No, go ahead. Go ahead. You have one more follow-up. Go ahead. Then it's my turn. I'm cutting you off.
One more follow-up.
All
okay, right. I know. Okay, so I don't know. So you're talking about people that are born with genetic abnormalities. I want to run this by you. I would love to get your opinion, and maybe your opinion will help other people. So I have, Justin and I are all about preventative care, but I do have a genetic condition. So I don't know if you're familiar with latent factor V. So I have latent factor V, which for those of you who don't know, it's a blood clotting disorder. So my blood runs thick, and I'm prone to blood clots, and blood clot goes through your heart. You get to meet Jesus. So if I'm on a medication, and it's just one, thankfully, I would go into the pharmacy, and I have your run-of-the-mill health insurance. Go into the pharmacy, I get a 3-month supply. Okay. My 3-month supply, face value, is $1,600 for a blood thinner. $1,600. I'm a butcher. Like, where am I getting $1,600 for 3 months? And then here's what they did, and I never understood this, and I was wondering if you'd be able to tell me how this was possible. The pharmacist would run a code card. It would drop to $10. You're telling me my health insurance didn't change. My policy didn't change. But my 3-month supply went from $1,600 to 10. Do you know how they do that?
Yeah, so I'm guessing that, it was something like a pharmacy discount card or a Good RX or something like that. And basically that is, if you look at, I believe I was just reading today that the House subcommittee on something was like it's part of this whole PBM dysfunction, right? That the PBMs are involved in how much the drug pricing is. And you'd have to have one of those guys on, because there is an answer, and I have had the answer explained to me, but for me to explain it to you is not worth it. But what I can say, here's what I could say. I had a pharmacist on my show, and we had this exact discussion, and I said, look, I tell all of my patients, like, I don't care what the answer is, especially the patients on the medication that you're on. Use the drug card, use Good RX, do whatever you got to do to get the medication in your pockets, right? When you can, it's always a good idea to go to the independent pharmacy in your area. And by independent pharmacy, that means like it's not CVS, it's not Walgreens, it's like has someone's last name on the door type thing. And just ask them, like, hey, what's the cash price for this? They usually don't take all of those other cards and all of the other stuff. They will take health insurance, but like mine, I know doesn't take Good RX. And that's always like the first step, because those guys are the only thing standing between you and only being able to pay whatever CVS will sell you the drug for. But anyway, she explained to me, she was like, yeah. All of those things are actually bad for the system, even though they're good for the patient. And I said, I'm going to tell my patients to continue using them because that's what they need. And I want them to have those drugs. And I'm going to let someone else figure this out. Shoot, but I have a name for you. I have someone you can interview and get the answer to that question.
That'd be really good.
Yeah.
That'd be fantastic.
We're always going to take names.
Yeah. All right, Justin, I'm done.
Thank you. Finally, line.
I was really wanting like a softball.
Tag me in.
All right. Softball up. Let's go.
I want to go back to, we have about 14 minutes on our time.
Yep.
I want to go back to preventative care.
Yep.
We're on this show, and we every week we're talking about what you can do to remain healthy. Now, there will be the one-offs or here and there that sometimes things just happen. You can't escape genetics all the time. You can't escape environmental factors. There's certain things that just happen to people, unfortunately, right? But there are preventative measures that greatly decrease risk of potential premature disease, as we're aware.
Yes.
Number one, how often, how much are physicians receiving as an education for preventative care? Number two, what is your view on preventative care? And number three, how do we guide people into preventative care?
Okay, so I have answers for all of these things. Give me 1 second.
All right.
See what you did? You laid out 3 questions so that George wouldn't say something stupid and detract from the conversation. I know what you did.
Doctor education.
I feel like they're all very related questions, and it's perfect because this is exactly what I want to talk about, because I think that the conversation, or the way that you think about preventative care, is the same way that you should be thinking about literally all of the things. First off, preventative care, it's painful to me to even think about it, because I remember when I heard the term preventative care and I thought, well, we should spend whatever amount of money, whatever amount of time, whatever amount of energy there is, and put it into preventative care, because why wouldn't you do that? Mm-hmm. Like, that is the common sense, interpretation of the word preventative. Mm-hmm. The issue is, and this is nuanced, but after you see it, you can't unsee it, is that preventative care means whatever whoever's selling you something says is preventative, right? So, there are lots of things that we have accepted as preventative care, and I am not going to weigh in on my opinion of any of these, but things like mammograms, things like colonoscopies at different ages. Mammograms is an easy one for me to really like get into and talk about, just because I started medical school in Germany, because that's where I was living at the time that I was ready to retire. And I remember going to those lectures and they were laughing at the US. They were like, this is so ridiculous. You guys. And I'm like, it's not me. I'm here. Like, I hear my accent, but here I am. But they said, you guys are sending all these women to go get mammograms. And I mean, he was an OBGYN, and he looked at me and he said, but what's the first thing you do when you see something abnormal on the mammogram? And I'm like, I don't know. I'm a second year, medical student. Like, I don't know. And he says, you send them for an ultrasound, a breast ultrasound. And I said, okay, cool. And he's like, so why not just have an ultrasound in your office? And I was like, I don't know. But like just the, and you could read the research on mammograms, and, there are arguments to be made about, would the breast cancer that you find on the mammogram have ever actually, grown fast enough that it did harm the individual, and vice versa? Like, is the breast cancer that was really going to ultimately end someone's life, like, is this preventative mammogram ever going to have done anything for that? Or would it have, been found some other way and then led to a diagnostic sequela, right? So like, I don't know. But the point is, my point in making this is, there are things all over the world that we consider preventative that some other European tier 1 country would laugh at, and vice versa. Right? Like, there are things that they do that we look at and we say, what sort of witch doctor medicine is this? And so I think as a patient, it's really important, because not everyone can understand, like, I don't know, relative risk and absolute risk and statistics, and like go through these studies that are in, these medical journals and say, oh, this is so stupid, and laugh at that one. Like, people shouldn't have to do that. I should be able to build my tire business because I want to build a tire business, right? I don't have to like learn all of this. But what I think is important is going into every interaction with the medical system and not saying, I'm not getting a mammogram because I don't do anything, but saying, we don't know what we don't know. And we really don't even know what we think we do know. And approaching it and saying, what is the risk here? Can you help me understand, why I should get this vaccine, why I should get this test that you're recommending? Like,
because Tiffany, as you're saying that,
yeah,
a lot of physicians that I've met, that I've had over the years,
yes,
if I rejected a shot, a vaccination of any sort,
yes,
it is, hold on a second, why are you rejecting this vaccine? Because
yes,
I don't want it in my body. There's not enough proof. There's not enough scientific data and research based on long-term effects of these particular vaccinations. I don't want it. Well, if you don't get it, you're going to end up getting this and this and this, and you can die. But if I also get it, you don't know if I'm going to get this and this and this and die. And so there's pushback. So I just want to interrupt you a second, because sometimes when you try to stand up for yourself,
yes,
there's pushback.
Well, and I think that is exactly what I was coming to, right? And I'm not like, again, there's no medical advice in this.
Yeah.
I don't care if you get a vaccine. I don't care if you get a mammogram. I don't care if you get a colonoscopy, like whatever. Like, that's between you and your doctor. What I do care about, and what I do feel like is a good indication of if you're in the right place, is when you say, hey, I've really got, concerns about getting, I don't know, the HPV vaccine. I don't know if this is something that I need, and I don't know how it's going to benefit me because X, Y, and Z, or my medical history, I had this reaction, or whatever it is. and you say the concern, I don't care how smart or how stupid it is. You, with your own body, go to this person and you say, I really have a concern. Can you help me understand? You're the expert. Help me understand why you're recommending XYZ, because I just don't get it. Or, I read all this stuff on Twitter and maybe it's crazy, maybe it's not. I don't know. But like, help me understand why they're saying SSRIs in pregnancy should be investigated. I'm pregnant. That's concerning. Like, should I do this? And if your doctor or your PA or your NP is a jerk, that's a full stop for me, right? Like, that is the piece of information. You don't have to know anything about medicine to know that someone who's handling you and isn't okay with you respectfully just asking to be educated by them, the expert, then I have a problem with that. And I think in all of just the discussions that I have with patients, and like I give talks at, like different medical associations will have like, a forum for people suffering from cystic fibrosis or COPD. And like, it's the same talk everywhere because it doesn't matter what the medicine is. It matters what the human interaction is. And you should always be able to go to your doctor and say, yeah, but I don't understand this. Educate me. And then the flip side of that, and I swear I'm almost done with my monologue, but like the flip side of that is that like, if I'm going to tell patients, like, I don't care what your strange sexual practices are or how much blow you're doing on a regular basis. Like, if I expect that level of honesty from the patients so that I can help, like, isn't it just fair that I respect them and show them that, like, no, we really are a team and this really is your body and I actually care about you. And I think that it's almost, it's definitely an informed consent thing, which, like, if you had to summarize my platform in 2 words, that's it. I just want informed consent for everyone. But I think that that's a two-way street. And I think that patients don't always have the power to say, yeah, I know that you're belittling me and you're treating me like garbage, but I really just need you to educate me, because there is a power dynamic. And it seems like this other person is up here, but the way that you regain the power is by saying, okay, maybe I need to find a new doctor, right? Like, maybe I need to change my environment. Maybe you can't do it in that time. Maybe there's a life-threatening thing that needs to be dealt with. Maybe you're in the ER. Maybe there's a 3-month wait list for you to go to a different physician. But I think that is the point that we need to get to where we say, I'm sorry. No, I'm not a doctor. No freaking kidding. Right? And that doesn't make me less than you. It means that I'm an expert on manufacturing tires and I make a lot of money doing that. But it's your job to help me understand. And if you can't do your job, then I need to go somewhere else. And I know that sounds like aggressive, but that's how I look at it, is that we need this respectful discourse, and it needs to be a conversation and it needs to be open, and doctors are going to have to get on board with that.
Yes. And this was where your expertise comes in, because you are handling things like that. So a patient comes in and they're looking for just fairness all around, somebody they can trust, something affordable, something that's not going between 20 different doctors and organizations and this and just all the confusing mumbo jumbo out there. Tiffany, what do you offer? What are you involved in that can help individuals?
Yeah, so I mean, I am a huge advocate for things like direct primary care. I own no part of any direct primary care practice. I'm not sitting on any boards. There are no financial issues there. But I really feel that when you have a doctor or a PA or an NP and a patient relationship that isn't complicated by all of these other incentives, that it really provides the best care and the least likelihood of all the runaround and going to specialists, because that doctor can spend as much time. So that's something. I have a show that's on YouTube where we host on Substack. We're on all the platforms, called the Healthcare Liberty Lab.
What?
And
Let's go.
yeah.
Love it.
And like, I love that because I get to have people on who do have opinions on mammograms or colonoscopies or, all of these things that I'm not going to weigh in on, but like, who will come in and will say why they believe what they believe. And you know what? Sometimes I agree with them. Sometimes I don't. Mm-hmm. But that's not my job. It's not my job to dictate medical care for everyone. It's, I see my job as just someone to facilitate conversations that allow other people to make their own decisions. I also write I write a few publications, or I write on a few publications where we do that. And then I work with companies who want help getting their messaging out. So if you have a healthcare company or something like that, and you're finding that like no one reads your emails or looks at your things, and you just like can't get patients to pay attention, like maybe you're talking over them, maybe you're talking about things that aren't relevant to them. And so my partner and I do some consulting in that area and help businesses with that. But I mean, I think my mission that I've realized, the place that I can be most helpful, is empowering patients to have conversations, the conversations that they need to have, and just to know that it's your right to have that conversation. It's your body, and you suffer the consequences. And sometimes those consequences are you lost 600 pounds and now you're really healthy and you get to live a different life. And sometimes those consequences are, you refused the IV antibiotics for your sepsis and you die, right? Like, and I think we have to come to terms with like, if you can't have all of the autonomy to make your own decisions without accepting that you are responsible for all of the good things that happen and also the bad things that happen. But that's why it's so important to be partnered with a clinical team that can communicate with you and can help you come to the best decisions for you and your family.
It's really good. Really good. We are at the top of this hour, and I can go for another hour. It's amazing. I really think a really good interview. I just so want a part two. George, you have any?
We'll find one.
We'll find a way.
We'll find one.
We'll find a way.
Find one.
No, that you really hit on a lot of great details tonight and opened up my eyes even, because when you hear, I listen to the Healthcare Liberty Lab podcast, and I've been on your show, and I'm a fan of your influence online, and just see the things you're representing and the guests you have, and I really feel our audience here at 600 Pounds Down, we really would strongly encourage you to go and listen and watch on YouTube, but also episodes can be heard on Apple Podcasts. I believe Spotify as well. Is that right, Tiffany?
Yep. Yeah.
So all the places. And on there, she has some great interviews, great guests that really get down to the nitty gritty of where we are at in the healthcare industry. And I've been surprised. I mean, you have just sometimes regular people that I'm like, wow, that's an amazing story. And sometimes you have professionals who are like opening my eyes to different things. So it really is great. How can they find you, and what can they do to find you?
Yeah, I think the easiest way is to go on Substack or LinkedIn. I'm Tiffany Ryder, on there, RYDER. And, I'm approachable. I'm available. Subscribe to my stuff on Substack. It's free. LinkedIn, connect with me, send me a DM, say, hey, I saw you on Justin's podcast. But I'm just happy. I'm happy to help. I'm happy to be there. And I actually really enjoy when people reach out to me and they say, hey, I heard you talk about this, but can you talk about that more? Right? I love the suggestions. I'm sure you guys do too, from your audience. Like you want to provide the things that people are most interested in and that are most helpful. And I feel that way.
That's really good. Yeah. And we'll put everything in the show notes. We'll get everything there, and we'll put that in the links there. You guys can go and visit that. It's just good. George, you have any closeout questions before we?
I really don't. I thought that was great. I think with a lot of the dichotomous opinions when it comes to the healthcare system, I think you were very fair. I think you were very fair, and you're very honest, and I love that. And I want people to understand too, like, it's so easy to go on mainstream media and go over here or go over here and get
Yes.
really mad about this over here, really mad about this over here. But just like Tiffany was saying, it's a mess. It really is. It's a mess, and it's circular in a lot of ways. And I think the best thing that we can do as of right now is find your voice in your doctor's office. I think that's
Yes.
number one. And a very close second would be, just like we always preach on here, is preventative care. Live a healthy lifestyle.
Yep.
Try to be as healthy as you possibly can. And if there are some things that are still going on,
Yep.
talk to your doctor and be vocal about it.
I love that.
Preventative care, I would say, friends, make sure, do your research. What Tiffany opened my eyes to tonight was preventative care can be different for anyone, really, who's prescribing the preventative care. And
Yes.
so it's, my stepson was diagnosed with diabetes a few years ago,
Mm.
and
Yep.
type 1.
Mhm.
And on top of that, celiac. So when we look at that, their preventative care was he could eat whatever he wants. And we knew better, by the way. We already knew.
Yeah.
We eat whatever you want as long as you give yourself insulin. And so go ahead and have the cake, go ahead and have the brownie, go ahead and have whatever you want. Not understanding that even putting, as treats, fine, but even putting those things in your body that is not healthy for your body, how it metabolizes and
Yeah.
how that creates havoc of inflammation in the body from what you're consuming. So, and so why it's important to have a healthy dietary approach when you have a disease of some sort is because you want to make sure you're toning down the workload of the body, because it's already doing some extra work by having to somehow, the pancreas isn't working. So we have some issues. Anyway, I'm going to get on a soapbox with that. I don't want to get on that, but you get what I'm saying.
Maybe that's
Preventative
part
care was
2,
that.
but come
Yeah, that'd
on.
be
Yeah.
part two. Yeah.
Yeah.
Seriously.
That's just, to me, I'm like, and we knew better,
I'm
right?
sorry, Justin.
Yeah.
Yeah.
It's sad. Great care
Yeah.
though. The people were amazing.
course.
Great people and great hospital. So nothing negative to say about that. But when it comes down to how do you prevent this and what can we do to help the situation, I'm not even asking to be medicine to restore health. I'm just saying, how do we continue to be healthy along the way? And it's just met with just ignorance to me. And you're teaching a
Yep.
16-year-old, 15-year-old at the time, this information, who is highly able to be influenced by someone like that, right?
Yeah.
Yeah.
And it's on both sides, right?
Yeah.
It's on the
Yep.
traditional side,
Yep.
and it's also in the alternative holistic world
Yep.
where, they have preventative stuff too, and you're like, okay, tell me more about that. So you have to be careful.
You do. No, it's so
That's right.
true.
Yeah.
Man, lots of stuff. Tiffany, we're so glad you're here today. Thank you so much for joining us on a live. 600 Pounds Down has not been live in a while, so we're thankful y'all tuned in tonight to check this out. We do encourage you to share this episode with anyone you think that would benefit from it. So you just simply go on Apple Podcasts, Spotify, Amazon Music. We do have people who listen on there. I know it's crazy, but we do.
That's crazy.
And also on YouTube, and you can go ahead and share that. We'll have Tiffany's notes in our show notes and any tag that she has that you can go and visit to get a hold of her and connect with her. I would highly encourage you to go connect with her on TikTok and all the socials as well. She has a lot to share on her platform. So thank you guys so much. Have an amazing night, and we'll catch you next time on, George, what are we called?
600 Pounds Down podcast.
Love y'all.
Thanks, you guys.